بسم الله الرحمن الرحيم والصلاة والسلام على سادة الخلق محمد وآله الطيبين الطاهرين عظم الله أجوركم بشهر الأحزان شهر محرم الحرام. First, my name is Abdullah Hussein al-Baghdadi. I'm a research physician at Graz Medical University. And my topic in this webinar, indeed, it is directed for the medical staff in Iraq. The problem that we have, the pandemic in its high peak in Iraq. Within this pandemic, we have lost many of our beloved families, members, friends. Many were lost, and the biggest pressure were indeed on the medical staff in Iraq. From a side, the shortage of supplies, from a side, the shortage of even personal staff, and from the other side, the huge number of infected patients in Iraq. The psychological part, indeed, it is one of the main problems we face in Iraq for the physicians themselves and in their relations with the patients. In this webinar, I'm hosting the clinical psychiatrists and working in NHS UK. The senior teaching fellow at University of Surrey, Dr Sarfraz Jeraj from UK. Doctor, thanks for accepting the invitation and being with me. Sorry.
Thank you very much, Dr. Abdullah. Assalamu alaikum, everyone. Yeah, it's a pleasure to be here with you today, and I look forward to discussing these some important topics around the challenges that the physicians are facing.
Well, in this webinar, we are divided in three parts. The first part will be doctors and hospitalized patients, especially patients with anxiety, and there indeed there's many things to share, but we'll talk in very general level, just because it is very deep topic, need a lot of to talk about, and our time indeed limited. So it will be just general ideas, then we'll go further maybe in other sessions. The second part will be doctors and home isolating patients. Also, we will go a little bit more details about this topic. And in the third part will be for the physicians themselves, how to cope within the pressure, how to cope, how to find balance within the situation for yourself, for your family, and to give the best you can do. After each part, we'll open 15 minutes question and answer time, and also for the colleagues from Iraq, they can share their experience in very limited time or short time, just to build a complete idea about the situation, how to deal with it. Dr. Sarfraz, I will start with the first part about how to deal with isolated patients. You know, I have many of them from my work and also my colleagues. The patient or his family member come because of the anxiety, fear, effect of the pandemic itself. Even for small symptoms or short light symptoms, their anxiety disturb our treatment. I can take full history from the patient, his his cognitive ability, let's call it, disturbed just because of anxiety. From other side, whatever I will tell them, they will not understand clearly, also because of the anxiety and maybe another reasons. How to deal with this situation as a physician? What things should I give attention for? Yeah.
Abdullah, can you just clarify? So, is this anxious patients? Is this in the hospital setting, or is this when they're isolating at home?
No, this is about hospitalized patients, inpatients. Yeah.
Yeah. So, I mean, first of all, I have to say that my recent experience of working with patients in hospital actually goes back some time. So I'm going to draw on more generic knowledge and skills. And I would really value the contribution that some of the doctors on this group also can share with us. But if I go right back to the basics of human nature, that when, as the clinicians, we want to support the patient, we want to help them, we want them to understand what they have to do, they're in this state of panic. They're in this anxious state because they feel danger, they're feeling threat. And if we want them to listen to us, we have to make a hard choice, and that is for us to listen to them. Now, you know, the reality is you've got so many patients to see. You don't have time to sit with each patient, to listen to their problems. But if we don't find some way of making the time for that patient to be heard, then their ability to hear us is going to be very limited. So maybe you can share maybe some ideas about from your own experience, but if you want someone to feel heard, start off with yourself. What have people around you done that has made you feel heard?
Listen.
Yeah, it's when they listen. So normally, you know, we're there with our stethoscope, with our flip chart, you know, we've got all the medication reports and everything, and we just wouldn't go from one to another. But when you have all of that, it stops us connecting with the patient. So just even in terms of body language, we can just lower some of those reports, just give the good eye contact. And even if you can't take in all the information, you know, sometimes what they're saying when they're really anxious, it may not even be coherent, but just give them that opportunity so they can start to feel heard. And, you know, I'm going to make reference to this on a couple of occasions, but there's enough research to show that we all have mirror neurons in our brains. And when the person who's really anxious is looking at us, is looking at how we're listening to them, is looking at the calmness of our demeanor, then there's some effect on them. And you can practice this. Yeah, you go with someone who's anxious, and one of our first reactions is to say, just calm down, calm down. The problem is they don't know how to calm down. Yeah. So instead of telling them to calm down, instead of telling them to relax, show them how to relax. First and foremost, in your own conduct, your own behavior, not raising your volume, just maintaining that. Sometimes if you speak quietly, the person has to quiet themselves down to hear you. Yeah. And the second thing is just showing them a quick exercise. You know, people, they want something practical, something they can start using now. So I'm wondering if you or anyone has any experience of any exercises that help when people are anxious.
Like sometimes just take deep breath 5 times.
Absolutely, absolutely. And what can make some of these interventions a little bit more effective, a little bit more powerful, if the person is willing, is to ask them to do something that's very different. I mean, breathing, maybe they're used to it, maybe they're not. It feels too simple. Make something different, like close your eyes. Say, please, if you can trust me, just close your eyes and let's just do deep breathing 10 times. Now, you can say this to the patient with your eyes open and you're just talking them through it, but you're not doing it yourself, and you'll see if they follow you. But if you close your eyes yourself and you start doing it yourself, they're much more likely to follow you. Yeah, I mean, we can do this experiment live. I'm telling you, right now, close your eyes and do some breathing. Come on, 1, 2. No, you're not going to follow. But if I do it with you, deep breathe in, let your shoulders drop, hold the breath, and release. Deep breath in, hold it, and release. Now, automatically, the patient is going to start adjusting the pace. I'm not saying they're going to be totally relaxed.
Yeah.
This is some practical steps that we can take. And actually, just doing this for maybe 20 seconds it feels like it's going to take a long time. But in terms of your communication, in terms of your management of the patient, you may save 5-10 minutes from repeating yourself, from just them being able to calm down and accept the treatment, or you know, to stop distracting you from treating another patient.
Yeah.
So this is some of the immediate elements.
Mm-hmm.
Now, I said that we need to find some space and time for the patient to be heard. But if you yourself are doing the job of 2 doctors, you know, because there's not enough staff, I'm just curious, is it possible that there's other staff in the hospital who are not doctors that could still do some of the bedside support, some of the nursing?
In shortage in all the staff.
Yeah.
All parameters, but
Yeah.
because all will get impacted indeed, and with the high demand, we need everyone.
Right.
Now we work with a lot of volunteers from medical university, and they do amazing job, mostly for home isolating patients, supervised by physicians, but to say because of that shortage, even some physicians, they are infected indeed, but they still work because of the shortage.
Yeah. Now, a couple of other steps that may be useful. So often people will develop more and more momentum in their anxiety because of what they're focusing on. So the more you focus on a particular area, the more it grows. Yeah. So if focusing on the aspect that's making them feel danger, that's making them feel threatened, increases that sense of anxiety, then that's obviously not going to help them. Now, obviously, people can't help it. You know, if there's some danger, you're going to keep focused on it. It's a survival mechanism. However, there's a difference between what you can control and what you can't control.
Mm-hmm.
Now, I'm not saying this is something easy to do, but it can help. And maybe giving an example to the patient, just saying, are you aware of what you're focusing on? And if focusing on things that you can't control is making you feel anxious, what's the alternative? So let's say I'm a patient. I'm lying there, you know, I'm struggling to breathe. My temperature is really high. And all I can think about is that these symptoms are going to kill me. And that actually, once I'm dead, then I won't be able to support my family. And then how will my children and my wife survive? But these are things that I can't control right now. So if I'm not focusing on the things that I can't control, then what should I focus on?
What I control.
Absolutely. Now, in that immediacy of the hospital bed, what can I control?
So following the advice of the physician.
Absolutely. So whatever steps you might have in working with them. And I think there's one thing that's important, that people often feel that they don't have control of their thoughts. And this is something we can just experiment with them. Say, I know it's really hard and you're going to keep getting pulled towards that. But if that's helping you, then good, you carry on. But at the moment, it really doesn't seem to be supporting your condition. So what are the other things more within your control that is more useful for you to focus on? And now for some people, it may just be something about what they're doing in the moment. Maybe some brief exercise. Maybe thinking about who you know, what their immediate plan is for that afternoon, for that day. That was part of their treatment. And I mean, just in general, when patients are bedside and they're not feeling so anxious, what would they normally focus on in a hospital?
Like what they do or what should do. What they do is just like some of them keep like in Facebook, just watching news, or WhatsApp message, which is 90% negative news,
Right.
fake news.
Right.
Yeah.
So I'm going to come on to that later, but I think one tool that we have now that maybe it wasn't so easy before is you have an electronic device, and this is something you can control. This is something you can engage with, and selecting which content that you engage with is going to be like, you can be much more strategic with that. So it'd be useful to hear, the ideas that people have, because maybe in that moment of anxiety, to think of something useful, something that you can control, to focus on, may be difficult to find. Yeah. Now, when we're under pressure, and particularly when patients are feeling very anxious, the lens, the outlook is all threat-based, and that squeezes out all the other parts of what makes us human. And one of the bits we if we can try and find opportunities, and I think Abdullah has some experience with this, is bringing in humor. Yeah, when there's so much at stake, when you're feeling so threatened, you can't smile. But if, as a physician, you can bring something, any example from the ward, from other patients, just something you've thought of, just a joke, even if it's a bad joke, the fact that you tried it might give opportunity for someone to just smile. And there's lots of positive impact on your physiology just from smile.
Yeah.
Abdullah, I wonder if you have any example of the last time you made one of your patients smile.
Well, I have one patient. He came with real anxiety. He said, "I'm afraid, like my family." I said, like he told me the symptoms, and I said, "Why are you afraid? Do you have problem with your wife or kids?" He said, "No." I said, "Well, from this symptoms, you have mild symptoms. You shouldn't worry. If you have another problem, I don't know." He just started to laugh and just bring the issue.
Yeah. Don't worry about being a good teller of jokes. Something that you've tried, and even this stuff around relationships. Most people can have some sort of humor, in response to jokes about marriage or parents or children, which can also just help to shift the attention a little bit away from the focus on anxiety onto just something else. Now, one of the other challenges is that we not only have patients who are very stressed and anxious, but sometimes when their family or someone responsible for them is coming to pick them up, and they themselves are getting really stressed, and maybe they'll take out their stress on you. They maybe become very angry. And as humans, as doctors, it's not that you have some special gift that that it's not going to affect you. Of course, it's going to affect any human being. But I guess this is one of those opportunities where we know if we raise our voice in response to them raising their voice, automatically it's going to get into a battle where escalation. And again, I want to come back to that theory of the mirror neurons, that this person is firing off. Practically for us, just if you can physically, just take one step back. Now, what that taking of a step back does is it moves you out of the arc of attack or arc of defense. So this is almost like a physiological mechanism where when you are close to someone, you're ready to prepare yourself to defend against any attack. Just before you say anything, if you just practice taking one step back, even a small step back, maybe you don't have space, small step back, you'll notice your heart rate goes down, your blood pressure can go down. And this puts you in a better position to not respond straight away. Most people, they escalate the argument or the stress because of immediate response. And we're all under time pressure, especially in these moments. Mm-hmm. But just being able to take that step can then help us to stay calm. Now, if we stay calm, the chances are that the other person is more likely to be able to listen, to feel heard, and we go through that cycle again. Now, there are just two more points I wanted to make before listening to some of your experience. And again, I acknowledge that none of these points that I'm saying are easy, and none of them are the full solution. But hopefully, in small measures, they can be helpful. And you may know all of them. Hopefully, it's a useful reminder. The opportunity to offer empathy. Mm-hmm. Someone is struggling. We said listening helps them to feel heard. But sometimes being able to say something, a specific empathic statement, can really make that the person feeling heard, not just feel heard, but validated. A lot of time, the function of expressing anxiety is to try and get some help. It's just a cry for help. So if someone can hear that, yes, I can hear that you're struggling. I can see that this is really difficult for you. You know, the kind of thing you would express if you were genuinely in their shoes. This can, again, make a big difference. I've seen a lot of clinicians with a really good heart, really, empathy. They can feel the pain of the other person, but because they never say it, the other person doesn't feel heard and they carry on. Mm-hmm. And then eventually the clinician gets fed up. Say, I'm trying my best to help you and all you're doing is shouting at me. But just being able to say that, I can see this is just really hard for you. This is really hard. You're normalizing their distress, and validating it at the same time. Yeah. So I think that was one important principle. And I guess just the last one is maybe getting them to reflect on their own strengths. That this is a hard time you're going through. Can you just tell me, how have you coped with this sort of situation before? Maybe you've never been in this situation, but have you been in any other difficult situation? How did you get through it? And reconnecting them with their blessings, their strengths, can be helpful as part of a bigger set of skills.
Mm-hmm. Yeah. So if I want to mention two things. First, what we use now with some patients, we give them tasks like deep breath every 2 hours with some exercise, light exercise, even if they're in bed. And to make it with an hour, like when he wake up, 10 o'clock, 12 o'clock, 2 p.m., 4 p.m., just within an hour. This would keep his mind with this task. So to take him out of this, what I call it, an anxiety zone, and keep thinking in the complications. And one of the patients I had, he had mild symptoms, and he told me once, he said, I can't breathe anymore. Maybe there's a problem. I said, I did ask him some question. I realized it's not with breathing, really, pulmonary problem. I asked him, what happened? He said, well, I was checking in the Facebook. I saw one of the friends, he was died. So I just looked to my kids. I imagined I'm died and they are orphans. And he went in scenarios for long, consequences, and then suddenly I couldn't breathe anymore. Just after 10 deep breaths, he's back normal. Yeah. And this part, you finished, yes? Or you want to? Yeah. Then also, if one of the friends have a question, please raise your hand or write in the chat part so I can ask it. But also I would like to share one scenario happened with me while my training in one country, indeed. So we're in ER, and there was a mother with her 12 years old girl, almost, with asthma attack. The problem that she became blue indeed because of the hypoxia. The senior physician, gave her all what she needs, right medications, oxygen, and we know it takes up to 15 minutes that she get normal. Oxygen saturation was okay. So she left her to go for the other patient. The mother get crazy because she didn't receive any explanations. The child still suffering as the look, she's still blue, not breathing normally, and the physician leave. So she started to shout, get panicked. Indeed, I went back to explain, but I was a trainee yet. So the physician said, we don't have time. We did our job. From medical side, she did everything perfect, but she missed one part, just to give the right message, which indeed would take much less energy and time than if we just explain that everything will be okay. 15 minutes should be normalized, just don't worry. Or just ask like other like a nurse or something that if they have time, of course. So even like indeed some of them, they think I don't have time, but indeed they miss more time, as you mentioned now. Yeah.
Yeah, it's a great point. I mean, and just sort of building on that, that often the anxiety, and you know, when I used to work on a stroke ward rehabilitation, the anxiety was often not being clear about why I'm even in hospital and what are they doing to me, and no sense of hope, no sense of time. Now, we might not always be able to give them a time frame, but at least if we can explain to them what we're doing, they can be on the same page as us. That can help manage some of that anxiety.
Also mentioned as the jokes, like I remember one patient in ER, he said, well, doctor, I don't want to stay in hospital. So I said to him, me too. It's just yeah. So let's move for the second part about how to deal with home isolating patients, which indeed we have like 6 points I want to address here. The first point, like loneliness and isolation, you know, to keep patients, some of them for even 1 month, to be home isolated. And because of the lockdown, they were previously, even before they get infection, for a long time home. They were just leaving for a short time. So all this complicated problem of being home, indeed, it is a huge topic, but we will compromise it in short time. So which message should I convey to the patient? What should I tell them to bring them out of the, suffer from this loneliness and home isolating?
Yeah, I think it's a very common problem, and I think a very understandable one. You know, one of the core needs of any human is to have that connection with people, and when you take that connection away, then you know that their core need is not being met. Yeah. So I guess what we have to try and support people with in these circumstances is thinking out